Welcome to this document from HM Government entitled Footnote Reform, Call for Evidence. The reference number on this document is CP1035. Footnote Reform, Call for Evidence, presented to Parliament by the Secretary of State for Work and Pensions and the Secretary of State for Health and Social Care, by command of His Majesty, April 2024. OGL. Copyright, Crown Copyright 2024. This publication is licensed under the terms of the Open Government License V 3.0, except where otherwise stated. To find this license, visit national.archive.uk/doc/open-government-license/version/3, where we have identified any third-party copyright information. You will need to obtain permission from the copyright holders concerned. This publication is available at www.gov.uk/official-documents. Any enquiries regarding this publication should be sent to us at footnote.team@dwp.gov.uk. ISBN 978-5286-4729-8 E030846220/24, printed on paper containing 40% recycled fibre content minimum. Printed in the UK by H Associates Limited on behalf of the Controller of His Majesty's Stationery Office. Contents. Each section of the contents has been recorded on a separate track for ease of reference. Therefore, skipping forward or back on your CD player will change track accordingly. On this track, Ministerial Foreword. Track 2, Executive Summary. Track 3, Footnote Reform, including context, the role of the footnote and the current limitations, and our approach. Track 4, Scope. Track 5, How to Respond. Track 6, Questions, including About You, overarching views of the footnote process, individuals and carers' experience, employers' experience, clinicians and non-clinical professionals' experience, information gathering and wider system integration, and miscellaneous. Track 7, Duration. Track 8, Next Steps. Track 9, Personal Information Charter, and Track 10, Freedom of Information. Ministerial Foreword. A healthy economy is only possible with a healthy workforce. As well as providing an income, work enhances mental and physical health, enriches community life, and provides purpose. This government is dedicated to fostering long-term prosperity and economic growth, and we want to establish a strong and resilient labour market that opens up opportunities for all. Building on the ambitious £7 billion employment package announced at the spring budget in 2023, the government announced its new Back to Work plan at the autumn statement, which will expand the employment support and treatment available and reform the ways that disabled people and people with disabilities interact with the state. However, there is still work to be done. While the UK's economic inactivity is lower than the G7, EU and OECD averages, following the COVID pandemic, economic inactivity due to long-term sickness rose by nearly 500,000. Footnote 1 here reads, OECD short-term labour market statistics, economic activity rates 15 to 64 years old, all people, seasonally adjusted for quarter 4, 2023, https://data-explorer.oecd.org/?LC=EN. Footnote 2 here reads, Inactivity due to long-term sickness measured by asking those who are economically inactive, not employed or searching for work, the reason for their inactivity. Long-term sickness or illness is one of the options respondents can select. INAC01 SA: Economic inactivity by reason, seasonally adjusted, Office for National Statistics, ons.gov.uk. Difference between January to March 2019 and June to August 2022. The document continues. Long-term sickness is now the main cause of economic inactivity amongst the working-age population. Footnote 3 here reads, INAC01 SA: Economic inactivity by reason, seasonally adjusted, Office for National Statistics, website https://www.ons.gov.uk/employment and labour market/ people not in work/ economic inactivity / datasets / economic inactivity by reason seasonally adjusted INAC01 SA. The document continues, but timely access to the right type of joined-up work and health support can prevent people with health conditions from falling out of work and give them the best chance of remaining and thriving in work. Across England in primary care, 93.8% of footnotes were issued as not fit for work. Footnote 4 here reads, Footnotes issued by GP Practices, England, September 2023, NHS Digital, data-fit-notes-statistical/fit-notes-issued-by, percentage 22 percentage 20 /O percentage 20 percentage 22 https://www.nhs.uk/data-fit-notes-issued-by-gp-practices/September-2023 percentage 22 percentage 20 /T percentage 20 percentage 22 _blank. The text continues. This means that over 10 million footnotes each year are issued where the patient is simply signed off, resulting in a missed opportunity to help people get the appropriate support they may need to remain in work. All too often, people are written off work without an objective assessment of what they could do with the right support, rather than what they cannot. That is why we set out our plans to reform the footnote process in last year's autumn statement. We want to facilitate timely patient access to specialised work and health conversations and support. We are shifting the responsibility for issuing the footnote away from primary care and reforming the way footnotes are issued so that people who can stay in work or return to work sooner with the right help are given exactly that. This will not only help create a system better tailored to an individual's health and work needs, but should also free up valuable time for GPs and primary care teams. Collaboration is key to achieving our ambitions. The footnote is part of a much bigger work and health picture. Healthcare professionals, employers, local authorities, the public and government all have a part to play. This call for evidence is an opportunity to seek your views and experiences of the current FitNote process, how it supports work and health conversations, but also the challenges and the enhancements that would better support people to start, stay, and succeed in work. Please provide your views and ideas to inform these trials and our plans for wider FitNote reform. A preventative healthcare system that integrates work and health services locally will support our vision to improve patient health outcomes, reduce health disparities, and help people get access to the support they need to return to and remain in work. Together, we can help build a healthier and more prosperous society for everyone. Mims Davis MP, Minister for Disabled People, Health and Work. Helen Whately MP, Minister for Care. That is the end of Track 1. Track 2. Executive Summary. This call for evidence will inform a programme of work announced at the Autumn Statement in 2023 to explore reforming the FitNote process to support those with long-term health conditions to access timely work and health support. We are gathering evidence to assess the impact of the current FitNote process in supporting work and health conversations and exploring the enhancements stakeholders would require for the FitNote to better support people to start, stay, and succeed in work. We welcome all views, particularly from employers, healthcare professionals, patients, carers, and those who access FitNotes, representatives of local systems or local system partners, for example, local authority, integrated care board, voluntary community social enterprise, and interested academics and stakeholder organizations. You can respond on behalf of an organization or as an individual. The easiest way to participate in this call for evidence is by completing the online form, which is a hyperlink in the web version of this document. This call for evidence is part of a wider suite of activity to reform the FitNote and will act as a prelude to a full consultation on specific policy proposals which will be launched later this year. That is the end of Track 2. Track 3. FitNote Reform. Context. Good work is good for health. There are 2 footnotes here. Footnote 5 reads, Association of Returning to Work with Better Health in Working-Aged Adults, a Systematic Review, PMC. Website https://www.ncbi.nlm.nih.gov/PMC/articles/PMC348767/ and footnote 6 reads, Is work good for your health and well-being? Brackets, website https://hwv/is-work-good-for-u.pdf. The document continues, as well as income, work gives an individual social interaction, a core role, identity, and purpose, among many other benefits. We know that work positively impacts people's physical and mental health and well-being, and we want to support people to stay in and return to work and to fulfill their potential. Everyone will occasionally need some time off work when they are unwell. However, short-term absences can lead to longer absences. With the right support, many people living with long-term health conditions can succeed in work. Helping people with health conditions to start, stay, and succeed in work is a crucial part of the economic success and well-being of every community. It also plays a key role in reducing health disparities. It creates the conditions for a more inclusive nation, but also for a healthier and more productive one. In 2022-23, 14.8 million people reported a long-term health condition, which represents around a third of the UK's working-age population. Footnote 7 here reads, Employment of Disabled People 2023, gov.uk. Website https://www.gov.uk/employment-of-disabled-people-2023/employment-of-disabled-people-2023. The document continues, with access to the appropriate support and where clinically appropriate, staying in work or returning to work as quickly as possible is, in many cases, the best outcome for an individual. It is also very important that this support can be accessed in a timely way. The evidence shows that the longer an absence from work, the lower the likelihood that someone returns to work, and their health often worsens. There are 2 footnotes here. Footnote 8 reads, Is work good for your health and well-being? Brackets, website https://hwb/is-good-for-u.pdf. And footnote 9 reads, Losing Life and Livelihood, a systematic review and meta-analysis of unemployment and all-cause mortality. Website https://www.science-article/ABS/P11-VIA=IHUB. The document continues, the role of the footnote and the current limitations. Footnotes are the medical statement used by eligible healthcare professionals to provide advice about the impact of a patient's health on their ability to work. They are issued to employed people in order to evidence a request for sick pay from their employer and also for the purposes of supporting a claim for health-related benefits. The footnote was introduced in 2010 to replace the sick note and to ensure patients received advice about the benefits of returning to work, and employers had the information they need to make changes to facilitate an earlier return to work. Footnote 10 here reads, Reforming the Medical Statement, Consultation on Draft Regulations, May 2009. The website http://webarchive.nationalarchives.gov.uk/http://www.dwp.gov.uk/consultations/2009/ reforming-the-medical-statement-consultation-28 May 2009.pdf. The document continues, the footnote should play an important role in the system, helping to keep people in work with or without adjustment, as it is often the first opportunity a person experiencing a health issue will have to discuss the impact their condition is having on their ability to work. The 2010 reforms included a new option to allow a GP to indicate that a patient, quote, may be fit for work subject to the following advice, unquote, and provide general details of the functional effect of the individual's condition and recommend common types of workplace adjustment, phased return to work, altered hours, amended duties, and workplace adjustments. However, between October 2022 and September 2023, across England in primary care, only 6.2% of footnotes were issued as, quote, may be fit for work taking account of the following advice, close quote, and this has remained relatively stable since we first collected data in 2016. Footnote 11 here reads footnotes issued by GP Practices England, September 2023, website https://digital.nhs.uk/data-issued-by-GP-practices/September-2023. The document continues. This means that over 10 million footnotes each year, of which a large proportion are repeat footnotes, are issued without any such advice, resulting in a missed opportunity to help people get the appropriate support they may need to remain in work. Footnote 12 here reads, footnotes issued by GP Practices England, September 2023, NHS England Digital, https://digital.nhs.uk/data-issued-by-GP-practices/September-2023. The document continues to support and empower better conversations about work and health between employers and their employees. In 2022, we enabled nurses, occupational therapists, pharmacists, and physiotherapists to legally certify footnotes. Footnote 13 here reads, more healthcare professionals given powers to certify footnotes, gov.uk, website https://www.gov.uk/government/news/more-healthcare-powers-given-powers-fit-notes. The document continues. Yet there has been low take-up of this reform. Between April and September 2023, only 8.4% of footnotes were issued by these groups, with the vast majority still issued by GPs. Footnote 14 here reads, footnotes issued by GP Practices England, September 2023, website https://data-information/publications/statistical/fit-notes-issued-by-GP-practices/September 2023. The document continues. To help address this, we updated our FitNote guidance for healthcare professionals, employers and employees in October 2023. Footnote 15 here reads, FitNote gov.uk website https://www.gov.uk/government/collections/fit-note. The document continues. The FitNote can be the first step to someone falling out of work and drifting into long-term inactivity. Feedback suggests that a key issue with the current FitNote process is that it does not reflect the diversity of needs when considering whether someone's health condition impacts their ability to work. This is because 1. There is currently not enough capacity or specific work and health expertise in primary care to make an effective assessment of a patient's ability to undertake work. Footnote 16 here reads, Exploring perceptions and attitudes towards the extension of FitNote certification. Website https://assets.publishing.service.gov.uk/media/5F294E94D3BF7F1 B111924AC/ exploring-perceptions-of-fit-note-certification.pdf. The document continues. FitNote can also be issued within secondary and community care, and while there is an ongoing project to embed the FitNote in secondary care IT systems in England, GPs continue to issue most of them. This may be using valuable capacity that could be better utilised with patients. We know GPs spend over 30% of their time on indirect patient care, including issuing FitNotes. Footnote 17 here reads, NHS England Delivery Plan for Recovering Access to Primary Care. Website https://www.england.nhs.uk/long-read/delivery-plan-for-recovering-access-to-primary-care-2/ The document continues. There is a missed opportunity for a patient and a relevant healthcare professional to discuss how they can stay in or return to work, or what adjustments could be made by their employer to offer them better support. Footnote 18 here reads, Exploring perceptions and attitudes towards the extension of FitNote certification. Website https://assets.publishing.service.gov.uk/media/5F294E94D3BF7F1 B111924AC/ exploring-perceptions-and-attitudes-of-fit-note-certification.pdf. The document continues. 2. There is no established route to refer people to more tailored or intensive support if it is needed. People with different health conditions and in different types of employment often need tailored support to help them stay in and get back to work. Where further support is required, its availability can vary and is difficult to navigate. This means that the current process is not meeting the needs of individuals, employers, and healthcare professionals in supporting people to start stay and succeed in work. For individuals, employees want to be fit and able to return to work as soon as they can, but often underestimate their ability to do so. We know that employees will benefit from being fit and able to return to work as soon as they can. Footnote 19 here reads, Association of Returning to Work with Better Health in Working-Aged Adults, a Systematic Review, PMC, brackets, nh.gov, close brackets. A prolonged absence from work often means people are less likely to return to work, and as a result, their health can worsen. There are 3 footnotes here. Footnote 20 here reads, Is work good for your health and well-being? Website https://assets.publishing.service.gov.uk/media/540f0b62d-f-f-d-e0df7/hwwork-good-for-you.pdf. Footnote 21 reads, Losing Life and Livelihood, a systematic review and meta-analysis of unemployment and all-cause mortality. Website https://www.science-article/ABS/P11-VIA=VIA=IHUB. And footnote 22 reads, Health in the Workplace, Patterns of Sickness Absence, Employer Support, and Employment Retention. Website https://health-in-the-workplace-statistics.pdf. The document continues, Getting access to the right type of support can help prevent health conditions from leading to unnecessary long-term absences from work. As an important point of contact, the footnote is a valuable opportunity to enable people to get focused advice and support about managing their health condition and work. But the current footnote process does not facilitate this. For employers want their employees to be fit and in work. Employers can support this through making adjustments in their workplaces, including supporting their employees to return to work more quickly where it is appropriate. Advice provided through the footnote can help employers to have quality conversations with their employees to enable them to return to work and remain in work. However, with just 6.2% of footnotes being, quote, may be fit for work, unquote, employers do not always get the information they need to give them confidence or understanding to have those productive and supportive conversations and in making appropriate adjustments for their employee. There are 2 footnotes here. Footnote 23 reads, Footnotes issued by GP Practices England, September 2023, website https://digital.nhs.uk/data-and-information/publications/statistical/ fit-notes-by-September-2023, and footnote 24 reads, Exploring perceptions and attitudes towards the extension of FitNote certification. Website https://assets.publishing.service.gov.uk/media/5F294E94D3B/F7F1 B111924AC/ exploring perceptions and attitudes towards extension of fit note certification.pdf. The document continues. For healthcare professionals. Healthcare professionals largely accept that good work is generally good for health and well-being. Footnote 25 here reads, Healthcare Professionals Consensus Statement on Health and Work, Academy of Medical Royal Colleges, website www.aomrc.org.uk/WP-content/uploads/2019/04/health-work_consensus_statement_09.pdf. The document continues. Some healthcare professionals, particularly those with a special interest and training, can and do get involved in conversations about work. Most, however, do not. Footnote 26 here reads, Work conversations in healthcare. How, where, when, and by whom. The website https://assets.publishing.service.gov.uk/UKG-A/how_where_when_by_whom.pdf. The document continues. We know there are significant challenges in fitting in a high-quality work and health conversation into a typical consultation in general practice, and it has always been recognized that most healthcare professionals issuing fit notes are not experts in occupational health. Footnote 27 here reads, Reforming the Medical Statement, Consultation on Draft Regulations, May 2009. Website https://webarchive.nationalarchives.gov.uk/UKGWA/reforming-the-medical-statement-consultation-28 May 2009.pdf. The document continues. Many healthcare professionals do not have access to the necessary time, resource, training, or support to confidently offer good work and health advice that meets the complex and varying needs a patient might have. There is therefore a risk that too many people are signed off as unfit for work without a conversation about adjustments that could be put in place to enable them to carry on working. Government wants individuals and employers alike to fully reap the benefits that Fitnote reform will bring. The government is aware that registered healthcare professionals working for private providers can and do supply online work sickness certificates to patients for the purposes of claiming sick pay as an alternative to getting a Fitnote from their GP surgery. We are concerned about the risk of this system being abused and are therefore keen to understand if this practice is widespread and the views of employers to inform policy, thinking about the role of these services within the reformed Fitnote process. Our approach. While Fitnote policy and regulations apply to Great Britain, Fitnotes are delivered in the health system, which is devolved. Government wants to develop and test a reformed Fitnote process in England that provides a more integrated work and employment support offer to help employers and employees to reduce sickness-related absence and, in turn, free up valuable time for healthcare professionals. At Autumn Statement 2023, the Chancellor announced £24 million to begin designing and implementing trailblazers in a number of integrated care systems, ICSs, in England to test offering better triage, signposting and support to those who have received a Fitnote for a prolonged period of time. These trailblazers will build on the WorkWell vanguards due to be announced this spring. The WorkWell services will provide a single, joined-up assessment and gateway into local employment support services to help people manage their health condition and get back to work sooner. This is part of an ambitious program to support disabled people and people with health conditions to start, stay and succeed in work. These include a new voluntary supported employment program called Universal Support, which will provide wraparound support to 100,000 people a year in England and Wales once fully rolled out, and the introduction of employment advisors in musculoskeletal services, building on the successful employment advisors and NHS talking therapies being rolled out nationally in England. The ambition is to co-develop a new process that brings healthcare and employment systems together to support people who are at risk of falling out of work or who have already fallen out of work due to ill health. The core components of this new process that we are testing are a triage service that supports people seeking a Fitnote into a pathway that best suits their individual health and employment needs, an assessment of someone's ability to do their job, and a work and health conversation with a healthcare professional or with a work and health advisor. Healthcare professionals and work and health advisors will have work and health training and dedicated time, making them better placed to take into consideration a wider set of factors that affect someone's ability to work. The ability to refer people to more intensive work and health support and assist employers in accessing expert work and health support through occupational health services where appropriate. Government believes these core components will produce a Fitnote service that facilitates faster and simpler work and health support. We understand the importance of developing a support offer that aligns with local needs and circumstances. Integrated Care Boards, ICBs, working closely with their Integrated Care Partnership stakeholders, including local employers, primary care, adult social care, council services and voluntary and community sector organisations, will have flexibility to design their approach to best suit their local population and local services, and to evolve their model as they test and learn more about what works. The Trailblazers will recruit clinical and non-clinical professionals into roles who should be provided with additional training and support to conduct robust and in-depth work and health conversations with patients. Individuals will be provided with advice and guidance on how they might be able to start, stay in, or return to work with the support of their employer. This new delivery model being tested will explore how the wider health system can take responsibility for issuing the fit note and situate it within a new service in Workwell Vanguard sites. This service will allow primary care teams to use their valuable time more efficiently and provide people with tailored health and employment support so that they can better manage their health condition in work. The impact of this new approach in Trailblazer sites will be evaluated and used to inform future policy design. The reformed Fit Note process aims to integrate smoothly with Workwell, enabling the people who need it to have a work and health conversation with a single, joined-up assessment and gateway into local employment support services. It will also complement the role of occupational health in ensuring employers understand and benefit from more expert work and health support to retain and support those in work. Whilst staying in work or returning to work as quickly as possible is in many cases the best outcome, we understand that the right support looks different for different people. For example, some people may need a fit note for short or time-limited illness, such as an infection or to recover from an injury or surgery, and can return to work promptly without additional support. Others may require a more detailed assessment and discussion about their work and health, including signposting to more intensive support where appropriate. Our commitment to reform the Fit Note process and this call for evidence will help us to better understand who needs additional support and how government can enable them to access it. In reforming the Fit Note process in England, we are committed to working collaboratively with healthcare professionals, NHS bodies and other stakeholders to develop and design a system-wide approach to this process. In addition to this co-design work, we want to understand and consider a wide range of views and lived experiences, including individuals as service users, carers, and patients. That is the end of Track 3. Track 4. Scope. Government wants our Fit Note reforms to be underpinned by as much evidence as possible and informed by a wide array of perspectives. The evidence gathered alongside the Trailblazers will inform a more detailed consultation later in 2024 on specific policy proposals. While Fit Note policy and regulations apply to Great Britain, health is a devolved matter. We are keen to hear a broad range of views from across the UK to inform future policy development. We know that the quality of health advice in primary care has been affected by capacity and knowledge constraints on job roles and occupational health, and that strengthened communication lines between healthcare professionals, employers and patients would strengthen this advice and facilitate better work and health conversations. There are 3 footnotes. Footnote 28 here reads, exploring perceptions and attitudes towards the extension of Fit Note certification, publishing.service.gov.uk, and footnote 29 reads, Statement of Fitness for Work, brackets RR797, close brackets, gov.uk, brackets www.gov.uk, close brackets, and footnote 30 reads, an evaluation of the Statement of Fitness for Work, qualitative research with general practitioners, website publishing.service.gov.uk. The document continues, we want to go further and broaden the evidence, views and insights we hold in order to better help people to start, stay and succeed in work. This call for evidence is focused on the impact of the current FitNote process in supporting work and health conversations and the enhancements stakeholders would need to better support people to start, stay, and succeed in work. We are particularly interested in views and evidence relating to the following themes: individuals and carers' experience, the patient's experience within the current FitNote process, and what opportunities there are to enhance or reduce frictions in the user experience. Clinicians and non-clinical professionals' experience, the experience of clinical and non-clinical professionals throughout the current healthcare system, and views on how to improve the FitNote process and work and health conversation. This includes the support required to improve information provided on the FitNote for patients and employers. Employers' experience, employer experiences of using FitNotes and the support required to use the FitNote to better support their employees to return to work, including in relation to the role of occupational health. Private work sickness certificates. The government is aware of private providers who offer to supply online FitNotes from a registered healthcare professional for a fee. They are often described as a work sickness certificate and can provide an individual with evidence for sick leave and/or sick pay without going to a GP practice. The government is interested in whether the provision of online private work sickness certificates is something that should be reviewed and is seeking views on employer and employee experiences. Information gathering and wider system integration. The potential to gather more information from those who need a FitNote to better support work and health conversations and outcomes. In particular, we are interested in views on how digital channels can support gathering this information and any risks and opportunities. The Department for Work and Pensions, DWP, and the Department of Health and Social Care, DHSC, together as the Joint Work and Health Directorate, JWHD, are seeking views on what our current and future policy considerations should include when reforming the FitNote process. The set of questions should not be taken to present that DWP and DHSC have reached a settled policy position. That is the end of Track 4. Track 5. How to respond. Please submit your responses via a form on www.forms.office.com/E/KU5J7SHWBE. If you have any issues, please contact fitnote.team@dwp.gov.uk, which is also a hyperlink in the online version of this document. If you prefer to respond via email or post, please send your response to fitnote.team@dwp.gov.uk, a hyperlink in the online version of this document, or by post, the FitNote Team, Department for Work and Pensions, Caxton House, Tothill Street, London, SW1H 9NA. When responding by post or email, please indicate whether you are responding as a patient, carer, or individual who accesses FitNotes, an employer, and whether the organisation is a large employer or SME, a clinical or non-clinical healthcare professional, a representative of local systems or local system partner, an interested academic, representing the views of a stakeholder organisation, or in another capacity. Please also indicate where you are located geographically: North East, North West, Yorkshire and the Humber, East Midlands, West Midlands, East of England, London, South East, South West, Wales, Scotland, Northern Ireland, or UK-wide. That is the end of Track 5. Track 6. Questions. The following section sets out the questions seeking further evidence. There are a number of questions, and you do not need to answer all the questions in this call for evidence. Please focus on the questions that you feel able to give us views and evidence on. We would welcome views and evidence from across the UK. There is no minimum word limit. We strongly encourage a maximum limit of 500 words per question, not including references. We recommend providing responses which contextualize and summarize the key points of the evidence they reference, as these are likely to be most effective. Given the volume of responses expected, submissions exceeding this recommended length may not be read in their entirety. About you. 1. Please tell us in what capacity you are responding. A patient, carer, or person who accesses or has accessed footnotes, a large employer, a small and medium-sized enterprise, SME, a clinician or non-clinical healthcare professional, a representative of a local system or local system partners, for example, local authority, integrated care board, voluntary community social enterprise, an academic, a stakeholder organization, other. 2. If you are responding on behalf of an organization, what is its name? 3. If you are responding as a clinician or non-clinical healthcare professional, please tell us what setting you work in: primary care, secondary care, community or social care, other. Overarching views of the footnote process. 4. How effective do you feel current footnote process is at supporting individuals' or patients' work and health needs? Very effective, effective, neither effective nor ineffective, ineffective, very ineffective, unsure. 5. What works well with the current footnote process to support individuals' or patients' work and health needs? 6. What can be done to improve the footnote process to meet individuals' or patients' work and health needs? Individuals' and carers' experience. 7. How useful do you feel the information in, quote, may be fit for work, unquote, footnotes is at supporting individuals' or patients' work and health needs, and why? 8. What, if any, additional information would be useful in, quote, may be fit for work, unquote, footnotes to support individuals or patients in returning to work from sickness absence? 9. Have you ever purchased a work sickness certificate from an online private company advertising themselves as a footnote or sick note service? Yes, no, unsure. 10. What motivated you to use this online service to purchase a, quote, work sickness certificate, unquote? 11. What was the experience of purchasing a, quote, work sickness certificate, unquote, from an online company like? 12. If the, quote, work sickness certificate, unquote, provided advice to support return to work, how useful was this advice? Very useful, fairly useful, neither useful or not useful, not very useful, not at all useful, unsure. 13. Please tell us why you feel that way about the advice provided in the, quote, work sickness certificate, unquote. 14. Was the, quote, work sickness certificate, unquote, accepted by your employer? Yes, no, unsure. Employer's experience. 15. How effective do you feel the current footnote process is at meeting employer needs? Very effective, effective, neither effective nor ineffective, ineffective, very ineffective, unsure. 16. What works well with the current footnote process for employers? 17. What do employers feel could be improved with the footnote process so that it meets their needs? 18. What, if any, additional information might be helpful for employers to have within maybe fit-for-work footnotes to support employees to successfully return to work from sickness absence? 19. What do employers need to feel confident in having in-depth work and health conversations with employees? 20. Have you ever received a, quote, work sickness certificate, unquote, or other form of fit or sick note from an employee issued by an online company advertising themselves as a fit or sick note service? Yes, no, unsure. 21. What was the experience of receiving a, quote, work sickness certificate, unquote, or other form of fit or sick note from an employee issued by an online private company like? 22. If the, quote, work sickness certificate, unquote, provided advice to support employees' return to work, how useful was this advice? Very useful, fairly useful, neither useful or not useful, not very useful, not at all useful, unsure. 23. Please tell us why you feel that way about the advice provided in the, quote, work sickness certificate, unquote. Clinicians and non-clinical professionals' experience. 24. Do you agree that issuing footnotes is a good use of a general practitioner's GP time? Strongly agree, agree, neither agree nor disagree, disagree, strongly disagree, unsure. 25. Please tell us why you feel that way about footnotes being a good use of GP's time. 26. What can be done to improve the footnote process to meet healthcare professionals' needs to provide more health and work support for patients? 27. What are the enabling factors for healthcare professionals to have an in-depth work and health conversation with individuals requesting a footnote? 28. What are the challenges for healthcare professionals to have an in-depth work and health conversation with individuals requesting a footnote? 29. What are the enabling factors for healthcare professionals in providing detailed and applicable advice in maybe fit-for-work footnotes to support patients' work and health needs? 30. What are the challenges for healthcare professionals in providing detailed and applicable advice in maybe fit-for-work footnotes to support patients' work and health needs? 31. What steps might the government take to support healthcare professionals or work advisors to have an in-depth work and health conversation with individuals requesting a footnote? 32. Which patients do you feel would benefit most from more in-depth work and health conversations? 33. How can those patients who would benefit most from more in-depth work and health conversations be identified? 34. What, if any, are the benefits and drawbacks of patients using online private companies to issue online, quote, work sickness certificates, unquote? Information gathering and wider system integration. 35. What knowledge, skills and support would healthcare professionals need to accurately assess the impact of a patient's health condition on their ability to work? 36. What knowledge, skills and support would work advisors need to accurately assess the impact of a patient's health condition on their ability to work? 37. How could we utilize digital and telephony systems to gather information to better support work and health conversations? 38. How could the footnote process more effectively link to different forms of work and health support, such as vocational rehabilitation, occupational health, and employment support? Miscellaneous. 39. What, if anything, can be done to incentivize and increase may be fit for work fit notes issued by healthcare professionals where being in work is the best outcome. 40. Please can you provide us with any case study examples of where the fit note process is working well to support people with health conditions to return and remain in work? 41. Is there anything else you would like to tell us about the fit note process? That is the end of Track 6. Track 7. Duration. This call for evidence will be open until 8th of July 2024. That is the end of Track 7. Track 8. Next steps. The views and ideas gathered through this exercise will inform the priorities and strategy for fit note reform. We will launch a consultation later this year to gather your views on specific policy proposals. That is the end of Track 8. Track 9. Personal Information Charter. DWP and DHSC Personal Information Charters can be accessed as follows. Personal Information Charter, Department for Work and Pensions, gov.uk, website https://www.gov.uk/department-for-work-pensions/about/personal-information-charter and Personal Information Charter, Department of Health and Social Care, gov.uk, website https://www.gov.uk/government-health-social-and-personal-information-charter. That is the end of Track 9. Track 10. Freedom of Information. The information you send us may be passed to colleagues within the DWP and DHSC. All information contained in your response may be subject to publication or disclosure if requested under the Freedom of Information (FOI) Act 2000. By providing information for the purposes of this call for evidence exercise, you understand that it could be released as part of an FOI request. If you want the information in your response to the call for evidence to be kept confidential, you should explain why as part of your response, although we cannot guarantee to do this, and this does not mean that it will be automatically blocked from release as part of an FOI response. DWP and DHSC always protects personal information under their personal information charters, and these details would be withheld from release as part of an FOI response. The Information Commissioner's Office, ICO, are the independent regulator on FOI requests, and further details on FOIs can be accessed here. This is a hyperlink in the online version of this document. How to access information from a public authority /ICO. If you would like to make an FOI request to DWP or DHSC, please follow the steps set out on the DWP or DHSC websites, and there follow 2 hyperlinks from the online version of this document. Make a Freedom of Information FOI request to DWP. Make a Freedom of Information FOI request to DHSC. That is the end of Track 10. The code number following at the end of this document is 978-1-5286-4729-8 E03084622. That brings us to the end of this document from HM Government, Footnote reform, call for evidence.